One of the questions that's important in CER issues today is how do you know when you have enough evidence? And this sort of comes from two vantage points. The first is if you're funding research, how do you know when you have enough evidence that you don't have to continue to fund topics on the same issue? The second is if you're somebody who is trying to make decisions around the evidence, how do you know when you have enough evidence to move forward? So if you're a patient and you're trying to decide what's the right next course of therapy with your doctor, if you're a payer, again, how do you know when you have enough evidence? And it's a rather complicated question because it is really related to a number of different issues. One is how convincing is the evidence that you might have? So is there a lot of evidence? Are there a lot of very big studies with very impressive results? That might suggest to you that you have enough evidence. But there's more issues involved than that, which might be things like, well, what's the regret factor? What if you were wrong? So we think we have enough evidence, and I'm going to make certain decisions around that, but part of it may be dependent upon whether if we made the wrong choice, that would be a very bad situation. And if the regret factor is high, you might wait and get more evidence. But then on the other side of the question is, how long would it take to get more evidence and how expensive would it be? So when you sit back and say, when do you have enough evidence, it's not a very simple answer, and it really is a function of many different issues, and the answer will vary depending upon the clinical situation, who is the decision maker, and what the options and alternatives might be.